First I have to classify the patient. What is that classify the patient means? What is simple weaning? Simple weaning means whenever the patient is proceed from the initiation of the weanings to successful extubation on the first attempt. I suspect the patient is extubatable. I put a patient on SBT. The patient is successfully forced and on the first attempt and extubated. This is called simple weaning. Okay, there is no problem with that. I thought the patient is extubatable. I tried SBT. My patient paused the SBT and extubated in the first attempt. It's called simple weaning. What is difficult weaning? Difficult weaning means patient failed initial weaning attempt. I tried SBT. The patient didn't tolerate the SBT. This failed SBT. Then require up to 3 SBTs. After that failed SBT, the patient require up to 3 SBTs or as long as 7 days from the first SBT to achieve the successful weaning. I tried SBT, patient didn't tolerate, or the patient took 7 days to extubation from the first SBT, which comes under difficult weaning, or after the first SBT, the patient required 3 SBT to successful extubation. It comes under the difficult weaning. Prolonged weaning means the patient who failed at least 3 weaning attempts or require 7 days, more than 7 days after the first SBT. So, it is called prolonged weaning. The simple weaning means I put an SBT, patient tolerated and extubated. Simple weaning. Difficult weaning, I attempted SBT, the patient didn't tolerate. The patient required 3 more SBTs or patient extubated from the first SBT within 7 days from the first SBT. It is called difficult weaning. Prolonged weaning is patient failed at 3 SBTs or patient required mechanical ventilation more than 7 days from the first SBT. It is called prolonged weaning. Okay. So, why it is important? We have to classify the patient as simple weaning or difficult weaning or prolonged weaning. They are important because this prolonged weaning patient had a high mortality, morbidity, prolonged ICU and hospital stay. If you see here in the first picture, this is the meta-analysis, this showed that proportion of the patients on percentage of the patient on simple or difficult and prolonged weaning. First see here in this study, almost all these studies have shown most of the patients, 40 to 50% of the patients are simple weaning, we can easily extubate. The remaining around 20 to 30% of the patients are in the difficult weaning group, almost around 10 to 20% of the patient in the prolonged weaning group. Okay. If you see the reintubation rate, it was very high in the prolonged weaning group compared to the simple and difficult weaning. ICU mortality also very high. This is a prolonged weaning group. This it's high. All these studies are shown. Most of the patient comes under the simple weaning group, but the reintubation rate and ICU mortalities are very high in the prolonged weaning group. Also, hospital mortality also, not only ICU mortality, hospital mortality also very high. ICU and ventilator free days are very less in the prolonged weaning group. Okay. What did you understand? If the patient is, most of the patients are simple weaning group. That means I put an SBT, the patient paused and extubated. But that morbidity and mortality also very less in the simple weaning group, obviously. The ICU free days, hospital mortality, ICU mortality, ICU days or duration of mechanical ventilations are very less in the simple weaning group. But prolonged weaning group patients are less, but they have the higher mortality or higher ICU stay and ventilators. What is your understand for more commonly that prolonged mechanical ventilation and difficult ventilation weaning groups have the higher morbidity and mortality. Okay. First, there are some common terms or we have to understand. First is the weaning success. Weaning success means I extubated, absence of ventilatory support within the first 48 hours of the extubation. I extubate the patient is not required the ventilatory support for the next 48 hours. This patient is called weaning success. Weaning progress means I extubated, I put on the patient on NIV, it is called weaning in progress. The next is the weaning failure. So, patient is failure of I put on SBT, the patient is not tolerated SBT, or patient is reintubated within 48 hours or death within 48 hours after the following extubation, they are called weaning failure. Weaning success means patient extubated not requiring ventilatory support for next 48 hours, it is weaning success. Extubated, patient required NIV immediately post extubation, this comes under weaning in progress. Weaning failure means patient didn't tolerate SBT or patient reintubated within 48 hours or patient died within 48 hours, they comes under the weaning failure.